Hello, everyone. Let's talk about acute sports injuries today. When we hear of sports injuries, we do know that we can get acute injuries, that is, injuries that happen on the field, and overuse injuries, injuries that can happen over a period of time due to repeated play. Today, we'll focus on acute injuries that happen during the field, on the track, and so on. One of the commonest injuries to happen would be a muscle pull or a strain. We commonly see that with the hamstring muscle, the muscle that runs at the back of the thigh. We do often see footballers having hamstring injuries and cricket players, especially batsmen. When they are trying to run between the wickets, they end up limping because of a hamstring injury. That's an example. And then they can also have ligament injuries. Commonly ankle, Achilles tendon injuries, especially in middle-aged men who suddenly take up sport and they do end up doing too much, then they can end up with a ligament injury. And then, of course, joint injuries. Sometimes, when somebody has a fall, they can. This is a model of the knee, by the way. When they can have a fall, and say, for example, this is the kneecap, and if the kneecap gets injured and it shears off to the side, you can take off part of a joint cartilage as well. That is what we call as an osteochondral injury. Sometimes ligament injuries inside, for example, the most common or the most popular ligament injury that everybody knows of is the ACL injury or the anterior cruciate ligament injury. This model, is represented in this model. It's represented here, as you can see. That's very important for the stability of the knee. So that can get injured. We see that in football and badminton players, especially they're landing on the knee awkwardly and twisting their body. So this twist creates a rupture of the ligament here. Even bones can get injured. Bones can break from direct injury. We see that in mixed martial arts. Or indirectly, when someone is skiing and they have their long skis that get trapped and has a twisting force, and that can twist the bone and they can have spiral fractures, so on and so forth. So yes, you can have a lot of these injuries during sport, but there are ways to prevent it. For example, the hamstring injuries. There's been studies to show that there's a specific exercise called eccentric strengthening exercise or Nordic strengthening exercise. And if you do that, and there's been studies to prove that the hamstring injuries have been reduced by almost 60%. And then, of course, there is a FIFA 11 plus injury prevention program. It's worthwhile looking it up, and that has shown to reduce football injuries by 30 to 45%. So yes, injuries are a part of sportsman's life, but certainly, you can take precautions to prevent them. Thank you.